All right, tonight we're going to do a presentation on COVID-19, and this is basics that I kind of put together to help people keep themselves and their families safe. A little bit about myself. I'm an emergency medicine physician. I've been practicing emergency medicine now for 30 years. In that time period, I've treated patients across, this will be my fourth pandemic, and one natural disaster and one mass shooting. I have my contact information on all the various slides there, which is just a website and Twitter and things along that nature if you need to reach out and contact me at any time. So the structure of the webinar is we're going to do 20-25 minutes of slides followed by 20-25 minutes of Q&A, and we should end right around at 8:45 or 9. The presentation is essentially the same from week to week. We will, because we've now been doing this now for probably about 6 weeks, what we're going to do is we're going to condense this beginner portion of it and then use an additional 10 or 15 minutes to go over updates, because a lot of information is coming out new almost daily, and I want to make sure to keep this slide and kind of move this conversation forward as we go through this pandemic. I am preparing that we are going to be dealing with this for the rest of the year, and I want to make sure as things occur that everyone keeps up to date. Everyone will be muted. You can ask questions through the chat box. Holly will be our moderator. She will unmute you if we don't have a lot of people on the call. So it just kind of depends if it's manageable or not. So you may be able to raise your hand, but you definitely can actually send in a question through a chat box. And some of you sent in some questions ahead of time, which we'll deal with first. Okay, so the purpose of this is to actually go over, how do you actually create an action plan and what do you do in this environment of uncertainty? One of the things that I realized from everything that's going on is when people haven't dealt with emergency conditions and emergency situations, sometimes what happens is you freeze and you get fearful as opposed to really getting in action and get empowered. So the intention of this webinar is that all the webinar participants will be informed about COVID science that will help you and your family stay healthy during this pandemic. The outcome is that at the end of this, you will leave the webinar motivated to create an action plan for you and your family that specifically applies to you. You'll also be motivated to create an action plan for your broader community. So what is a pandemic? A pandemic is a worldwide spread of any infection that people do not have immunity to. So examples are smallpox, polio, tuberculosis, HIV, bird flu, SARS, this is a SARS-2, and also MERS. Why is it called COVID-19? So CO stands for corona, which is the way it looks like a crown or halo. VI is virus, D is disease. 19 was the year that the strain first appeared, which was December 2019, and hence the name COVID-19. Why is this so important? All of us have experienced a pandemic before, and there are basically two outcomes. One outcome is a complete cure or near complete cure, so either smallpox or polio. The other outcome is where there's some sort of containment or management without a cure, so you think of something like HIV. Now let's talk about coronavirus and how it's spread. It's primarily people and surfaces. So it is droplets that land on surfaces, and then you touch the droplet, and the droplet, then you touch your face or your mouth or your nose or something along that line. It could also be coughing or forceful exhalation or sneezing. So I tell everyone, really respect COVID-19. In addition to being a droplet disease, it stays on surfaces for a very long time. Cardboard surfaces, like food delivered to your house, it can stay on the surfaces for 24 hours. Plastic surfaces or metal surfaces, it can stay on the surfaces 96+ hours. Also, it's highly contagious. So how is that calculated? Well, one thing that we look at is minimum time of exposure needed to infect another person. For COVID-19, that's 45 seconds. Then there's also percent penetration. So if 100 people got exposed to it, how many people would actually contract the disease? Typically for like influenza or regular flu, it might be 20 or 25. For COVID-19, it's 60 to 80% penetration. What do we mean by a droplet disease? A droplet disease is a large droplet that hits mucous membranes. Airborne are small particles that are inhaled. So droplets are greater than 5 microns in size. Airborne is less than 5 microns. Initially, we thought that COVID-19 was acting only like a droplet disease. It has a droplet component, but there does seem to be a component of it that is acting a little airborne, but it's not a completely airborne disease. So a droplet disease falls 3 feet from the 3 feet or less. So that's why the initial recommendation said to stay no further than 3 feet from everyone. An airborne disease can land 5 feet or further from the origin. Hence, we have the new recommendations of 6 feet. Examples of droplet diseases: Ebola, pertussis, mumps. COVID-19 is still categorized as a droplet disease. Examples of airborne diseases are like tuberculosis and measles. Now, this just shows a schematic of what it actually looks like. So the droplet disease would be something like Ebola in red, and an airborne disease would be something in gray that goes out further. So as you can see, any surface that actually might be along this distance then is where the droplet would land. Then it's like, how do you actually get in contact with that surface or touch that surface, and that is how the disease is transmitted. So you really have to look at high traffic surfaces, specifically doors, knobs, handles, debit card pin pads, gas station pumps. Today I was actually driving up I-95 and I specifically stopped in New Jersey because I knew they pump your gas. Phones. Hospital workers have to look at shoes and scrubs that they may come home in. So let's talk about the risk factors. So the CDC has several risk factors. I'm going to talk about the ones we know, and I'm going to talk about the ones that we may not be as much aware of. So born on or before 1955. They say elderly, but there's a lot of people at 65, 66, 67 do not consider themselves elderly because they go to the gym or they run marathons. They're still very active. So the criteria is actually born on or before 1955. Anyone who's in a nursing home, long-term facility, I would also add to that correctional facility or rehab facility. Other high-risk things that are not talked about much is when they talk about lung disease, people think about asthma and COPD, but you also have to consider things like sleep apnea. Heart disease is basically any sort of cardiovascular heart disease or stroke. Immunocompromised could be an HIV patient, someone with sarcoid, lupus, rheumatoid arthritis, cancer treatment. People of any age with severe obesity. This is very, very, very important. And I'll go over this a little bit more on the next slide, but a BMI, which is a body mass index greater than 40 at any age. And then pregnant people, they're not calling it a risk factor, but they do know that pregnant women in general are known to be at risk for severe viral illnesses. So let's talk about the BMI. What does a BMI over 40 look like? A BMI over 40 is 5'2", greater than 220 pounds, 5'6", greater than 250 pounds, 5'10", greater than 280 pounds, or 6 feet greater than 300 pounds, man or woman. So, and at any age, this is a risk factor. So the other thing that we're noticing with COVID-19 is men are more likely to get the disease, and when they get the disease, they do poorly when they get it. So New England Journal of Medicine found that the infection rate is not split 50-50. It's like 58% male, 42% female, so about 20% more men. The other thing is that the death rate is extremely higher for men. So it's almost 40% higher. So with men, about 2.8% of them die. With women, about 1.7% of them die. One risk factor increases the likelihood of ICU, respirator, or dying by 79%. Two risk factors increases the likelihood of requiring an ICU, respirator, or dying by 250%. So you want to make sure if you have risk factors that you're actually taking a higher level of precaution. So let's take a look at, some people have asked me, are certain risk factors more not as risky as others, or other risk factors are more likely associated with a bad outcome? So basically, the risk factor that really causes the most problem is cardiovascular disease. But all of them actually are much more than what a healthy person, 9 out of every 1,000 die of healthy people. So let's talk about prevention measures. How do you prevent getting COVID-19? How do you prevent spreading it? And then what do I do if myself or my family get COVID-19? So we've all talked about proper hand washing, but I actually wanted to show these actual 8 slides, because these are the 8 things that are important with hand washing. People often don't know, from medical school, we spend a lot of time on hand washing. Normally, most people wash their hands and they maybe do number 1 and number 2, which is their palms of their hands and then in between their fingers. But they forget the back of their hands. They often forget the base of the thumbs, the back of their fingers, and their fingernails. I actually recommend people cut down their fingernails if they've got long fingernails, and their wrist. And then finally rinsing and patting everything dry. So that is actually the 8 steps of actual proper hand washing. Now, the power of social distancing, this is really important. Before the middle of March, when we did not do a shutdown, one person in 30 days would infect about 406 people. Now, with where we are now, we're about at 75% less exposure. You have one person that might infect 2.5 people. So social distancing is very important and will actually remain important in decision makings around reopening employment, how we do that, what it looks like, until we actually get to a vaccine. So in addition to hand washing and social distancing, people are always asking, what else can we do? So the main thing I tell people is, do not go to the grocery store. Please try to get all your food and medication online. If you're older and you have a computer, but you're not that savvy with it, call someone and see if they can actually walk you through how to order your groceries online. I've also been working with my parents on Green Chef and some of the plated, so that they can get some variety, because they get tired of the food that they make in their home all the time. The other thing is that if someone is elderly and not on a computer, looking at having someone just, buy the groceries for them and they can put them a check in the mail. When a delivery person comes to your house, there should be no contact with the delivery person, not even a handoff. So I normally have the delivery person put the package on the floor outside. Then I go outside and I actually spray that with some sort of Clorox or bleach or hydrogen peroxide containing a cleaner. Then I leave it out there for 2 or 3 hours. I bring it into my house and I immediately throw away any of the paper, cardboard boxes, and transfer it into my own containers. When I bring it into the home, I set it on the floor. I don't set it on the countertop or the table. Remember, that's a surface that you're going to touch more frequently than you're going to touch the floor. Surfaces that you do touch, like countertops and tables, you want to actually clean those more frequently than usual. I also tell people avoid cash whenever possible. Cash is something that also touches a lot of hands and goes through a lot of different people. When you use your credit cards, wipe them down after use. The other thing that's important is that they found in China and in Italy that small groups of extended family would get together for holidays or celebrations or funerals, and then they would infect each other, and family members in clusters would then die. So it's very important. I know sometimes it's very tempting to just get together for holidays or celebrations, but during this time we actually can't until this is over. Now let's talk about people who have asthma or people who are caring for folks with asthma. This is very important. Do not use your nebulizer at all if possible. A nebulizer, when you get an asthma exacerbation, you really don't know if it's asthma or COVID-19 because you don't have an at-home test that you can actually perform. So if you actually, and you'll have exactly the same symptoms, it will seem exactly the same. If you use a nebulizer, you've now turned that droplet disease into an aerosolized disease. So if there's people living in the home with you, you've now aerosolized it throughout the home. So instead, what you want to actually use is an inhaler with a spacer or an aero chamber. The picture of that is over to the right. That delivers the same amount of medication as a nebulizer machine. The other option is that you can go outside and use a nebulizer machine either outside or in a garage or in a space where you are not connected to the main house. Now let's talk about facial hair. There's a couple of things around facial hair. My recommendation is to get rid of it during this time period. Two things. One, if you're wearing a mask, it doesn't fit as well if you have facial hair. The other thing is that we have found that people who don't do as well with this disease, they got a lot of virus, like a viral load that was higher than people that did do well. And so mustaches and beards are places where the virus can kind of accumulate before it actually goes through their mouth or nose, etc. So my recommendation is just to get rid of it. To wear a mask or not wear a mask, we've been recommending wearing a mask here for almost a month, 6 weeks or so. I tell people if you're on a trail and you're exercising and there's no people near you, you're walking a dog and there's no people near you, you don't necessarily have to wear a mask. But certainly if you do any sort of run to any sort of store for some emergency reason of some sort, then I would absolutely wear a mask. Women who are pregnant or near delivery, I would highly recommend a home delivery with a midwife. There was a L&D, labor and delivery division in London, and almost all of their nurses were positive for COVID-19. I wouldn't risk going into a hospital for anything unless I just literally thought I was going to die at this point in time. Miss your personal care services. As you will see when I take off the video, my hair is tied up and wrapped up. Do not have anybody go to your home to get your hair or nails done. Do not allow anybody to come to your home and get your hair and nails done. It's just really not worth it at this point in time. So let's talk about an action plan. So what if I think I have COVID-19? What are the symptoms? So the main thing that's important is that you can have no symptoms and have COVID-19. So Iceland, that actually has tested the highest per capita of their citizens, found that 50% of their COVID-19 positives had no symptoms. That's 50%. Another early warning sign that you have COVID-19 is a sudden loss of smell or taste. GI symptoms can also be associated with COVID-19, nausea, vomiting, and diarrhea. And then you have respiratory symptoms, which is headache, fever, achiness, and then a lower respiratory symptoms, which is your dry cough and difficulty breathing. And those are the patients that get into a viral pneumonia and then have to actually be intubated. What do you do if you think you have COVID-19? Well, initially the World Health Organization said avoid taking ibuprofen. Then they kind of walked that back. They were suggesting primarily stick with Tylenol. I don't know if they had industry pressure to walk that back or what, but I would actually tell people, really defer and take Tylenol. Don't go to the hospital unless you're really, really sick. I get a lot of questions about testing. Testing varies by state. Ideally, we would have consistent testing across states, but we do not have that. So everything really kind of depends. If it's a state that I've worked in, I may be able to tell you more about it. But if it's a state that I have not worked in, I may not be able to tell you much about that particular state. A lot of folks have asked about social distancing versus self-quarantining. Social distancing is for everyone. Self-quarantining is for somebody who has COVID positive or has the symptoms and have not been tested. And that's very important because of inability to get the test. If you have the symptoms, it's very important that you self-quarantine. Social distancing is staying 6 feet away. Quarantining is complete isolation. You're in a room by yourself and you do not come out. Someone can bring you food, set it at the door. If you're going to go out and use the restroom, that restroom should not be a restroom that's used by other people. Social distancing for us is for now. Self-quarantining is for 14 days, preferably 21 if you can actually manage that. In Italy, they found that after 14 days, they had people that were still positive, even though their symptoms had gone. So it's very important that at a minimum is 14 days, even if you're feeling great on day 3. Now, some folks have said, well, maybe I should just get COVID-19 and then I'll get immunity. Well, that's not really a great idea. This actually sits in your lungs, this infection, and it causes scarring and fibrosis. The viral pneumonia has about a 50% death rate. Those who survive it, 30 to 40% of them have decreased lung capacity, and some have elevated liver enzymes for months. Like some of them have not normalized since their infection in January. So we only have about 3 or 4 months worth of data. The other thing is not everyone gets immunity, and the immunity is not necessarily lifetime. So some people have immunity and they seem to have it for a couple months, but China has already seen people who have caught COVID-19 twice. How to win against COVID-19. Early detection, early response is the name of the game. The other thing to do is universal precautions. So universal precautions are this. I assume I have COVID-19. I assume you have COVID-19. You assume you have COVID-19. And you assume I have COVID-19. So when I go out, I assume everybody has COVID-19 and I act accordingly. The importance of testing, as I said, asymptomatic people can actually spread the disease. This was a town in Blois, Italy, that was got themselves COVID-19 free, and they were able to do that once they began testing not only the symptomatic people, but the asymptomatic people. Okay, we have COVID-19 already and we're in the ICU. I added this slide because I had a family member of mine that after I gave this presentation, I did not realize was in the ICU. They unfortunately passed this Sunday in the Detroit metropolitan area. So a couple of things, I put my contact information there, but I think there's a couple of things that are very, very important. One, COVID-19 patients, those that have what they call like an adult respiratory distress syndrome, do better ventilated on their stomach. So that means rather than being in an ICU bed on their back, they should actually be on their stomach. The ones that do not have the ARDS symptoms, they actually do better not being ventilated at all. You want to actually really kind of for yourself think about some forward-thinking actions. Oh, I wanted to actually bring up, there's some experimental protocols, and I'm not sure if I have a slide on this, but the chloroquine and hydroxychloroquine that the president has been talking about, those clinical trials were abruptly stopped. They were not helping, and they caused cardiac disease. So some forward-thinking actions. Consider now, if I had to be quarantined, where would I do it in my home? If you get sick, do you have the over-the-counter medications that you need? If you don't, purchase them now. Do I have mask or mask alternatives? Scarves or head wraps, anything that's two-ply cloth and covers your nose and your mouth is sufficient for what you're doing in your daily life. How am I going to limit my exposure to highly trafficked surfaces? If I'm with a company or a union, what's my occupational plan? How is my job actually taking care of me? How do I make the requests for the things that I need to actually request? If you're a state or local government, it's very important that the states and local governments engage a multidisciplinary group of community leaders, medical professionals, and elected officials to actually deal with outreach, PPE strategies, staffing, and healthcare access. This is just something from CNN Business News about these were the flight attendant unions at 100 of American Airlines flight attendants have coronavirus. Since this was actually reported, the White House put something out that companies no longer have to tell you that their employees have become positive. What is next? We're going to continue social distancing until we've turned the corner. I'm telling people if their employment is significantly impacted by COVID-19, they really should look at something that they can do online. We are looking at roughly about 12 to 18 months, which would be quick for a vaccine. They started testing some vaccines in Washington, in the state of Washington, about a month ago. And my understanding is that they have been testing 2 vaccines in China for about 2 to 3 months. It's important to stay alert and informed. The absolute best, to me, source of information is the World Health Organization. I find that in what they're doing, they've actually been the most accurate and the most quick to post things. Respect COVID-19. Create a plan for yourself and your family, given what you're dealing with your own health and disease and what you do in your daily life. This is just our Twitter page. And I have one of the experimental protocols from Duke Medicine pinned to this. And the website, we've actually been loading up the articles as we get them on the website, so you can actually see the reference material for a lot of the things that are in this presentation. All right, so we're going to turn it over to Q&A.
The question that was emailed prior to the webinar tonight.
Okay.
If you have been exposed to someone who tested positive for the coronavirus and you notified your primary care physician and your health department, what is the obligation of your health department to you?
Okay, so this is another thing that varies dramatically by state. Okay, I was just in a conversation this morning with someone who said that the Rhode Island State Department actually called her back. I was shocked that she actually got a call back from a public health department. And it would be good if, yeah, Janina, it would be good if you actually, if you're on, that would be great if you would share. I don't know, Holly, if you could unmute Janina.
I can, one moment.
Yeah. But that is not actually that's not normally what you actually see in public health departments. They're usually very strapped. Their budgets have been cut year after year after year. And they are not usually an organization that actually calls you back. But Johnny, you want to share what happened with you? And this was in Rhode Island.
You'll need to unmute her because you're still the host.
Oh, okay. All right, cool. All right. Okay, Janina?
Hey, this is Janina. Can you hear me?
Yes.
That is a very old picture for anybody watching. I'm not as brave as Valda. Holly, can you ask the question again? Was it about what to do? Like, what's the obligation of your health provider?
Yes. What's the obligation of the health department to you once you report it?
Okay, awesome. So I literally went through this. So I had a telemedicine appointment. So I'm Janina. I live in DC, but I also, right now I'm temporarily in Rhode Island with my mom. And I had a telemedicine appointment on a Friday. They filled out the form. He sent me a prescription, but Rhode Island has like a whole form you have to fax and everything like that. So what I was told was your doctor, so like Dr. V said, in every state it'll be different. Essentially, your doctor is responsible for contacting the infectious disease control or department, and they then will submit the information, and then your doctor will call you back with an appointment to one of the test centers. So I think for some of the test centers where it's like not the rapid response, that that's kind of the process where your doctor submits it, they call you back. A friend of mine had a prescription for the test on a Thursday. They called her, this is also in Rhode Island, called her on Monday. Her appointment was then for Tuesday. So that was the turnaround time. Now, in a couple of states, in Rhode Island, in Massachusetts, and I think Georgia, CVS has rapid testing that you can have an appointment same day, but you still need your doctor's note. So in that case, I actually had emailed the health department and also left a message. And that's where Dr. V said they called me back, which was amazing. So one, I would say, look for your state's hotlines, because some of them might have hotlines set up where you can actually get the health department or somebody to call you back. And two, if your doctor sends you a prescription, either like PDF by email, or if you're at the office and they give you one, you can probably sign up for the same day testing. In Rhode Island, they have regulations, like it needs to be a you have to be a healthcare worker or at risk. So I am living with someone who's older. So that was something that the doctor did put on my prescription. So again, like you really want to be in communication with your doctor and looking at what the state requires, because in the end, the submission that he sent in to the state didn't actually go through correctly. So if I had not set up my appointment through the rapid testing, I would not have been tested. So
Yes.
I hope that provides some clarity around some of the steps and how to advocate for yourself and to use the hotlines that your state set up.
Yeah, and there's other states that actually have like clinical protocols. So you can, if your doctor writes a prescription or not, it really doesn't matter. They're not going to do the test unless it actually meets the clinical protocol. I'm going to show everybody, this is what the clinical protocol looks like for the state of Virginia. Can everybody see that?
Mm-hmm.
Okay. So it's actually very, very, very complicated, right? So Virginia has made it very complicated. I had a cousin in South Carolina. She actually had an exposure at work. She worked at a nursing home. She got a prescription. They told her the testing center to go to. And when she got there, her doctor, which is a kind of an older family practice doctor, was not part of the healthcare network and they wouldn't do it. I had another cousin in Detroit, very, very sick, airline attendant, somebody that you would definitely want to actually get tested and trace everyone that she was in contact with on the plane. And despite having a fever, a very high fever and requiring IV fluids, they still would not test her in Michigan. So that's not really the answer that you want to hear, but this is the facts of what we've been dealing with. So the testing really varies state by state.
All right, thank you very much. And while I'm asking the next question, if you want to switch the host, I'll manage the controls, but we do have other questions in the queue. Next question is, there's so many questions, I love it. The next question is, Dr. Crowder, can you please share your family experience with with COVID-19? And you talked about that a little bit.
Yeah, so like I said, my cousin's husband, he passed on Easter Sunday. He probably had been in the ICU for about 10 days or so. I have family members in Mississippi that I think weren't really sure whether or not to take it seriously, because there's been so much coverage about New York being an epicenter. And I think that kind of gives people the false conclusion that maybe it's not in their town yet or something. So they've gotten on this webinar and they've gotten in action. My parents, I am actually up here in New Hampshire working, I was going to have them take care of my dog, and they're like, no, you've been to the emergency department, you're not invited. And I get it. So that's kind of the range with my family so far.
Okay. And our next question is, I've heard some recommendations for 17 to 27 feet as needed instead of the 6 feet. Is it safe to keep 6 feet? And a second part, if I go for a walk and pass people, am I at risk?
Yeah, so this is what I'm doing around this. I've gone on the trail a couple of times, the trail that I walk on, and there's sometimes on a Saturday or a Sunday, and it is crowded, and I wear my mask. Particularly if there's bikers zooming past me with a high velocity. And so I actually wear my mask on the trail. I think I would sort of moderate this. If I felt like I had, one or two of the risk factors, I would wear my mask all the time.
Absolutely. All right, next question from the chat. How can we stop the administration from defunding the World Health Organization?
Yeah, well, luckily, we're not the only one that funds the World Health Organization. And I think that, although this is, I think it's kind of like a publicity stunt that he's doing to try to put the blame on someone else. I think that General, I think his name is Garasis. He's the general director for the World Health Organization. I think that they're going to come back fighting pretty hard and actually show when they actually gave everything to the U.S. And if they show that information, we had the DNA sequence for COVID-19 in January. We had our first case of COVID-19 in January. So that information is not going to look too good. I ordered my PPE for myself in January, and I don't get daily intelligence briefings. So let the men in charge fight it out, and in the meantime, we need to keep our families safe so we can go to the polls in November.
Thank you. We also had another attendee type in the chat other suggestions around helping the World Health Organization, acronym WHO, to call your elected officials and to start a GoFund WHO campaign.
Yeah, I would definitely say call your congressperson.
Absolutely. And we will continue to take questions. I'm going to go to the next question. What diet or dietary supplements do you recommend to build immunity?
So it's interesting. There are a couple of things that have actually found to work in this. One is it's important that people continue to exercise, which is kind of hard when you're kind of cooped up. You kind of get into this mode. And I find I'm a very active person, and I've had difficulty even in this environment doing this. But exercise increases your immunity. The other thing that is important that we have found to be important is zinc. So there was a protocol that included some medications and zinc that they're studying that was done in a Jewish community in upstate New York, and they had no one that went to the ICU. So zinc supplements seem to be something that is important. Outside of that, I mean, I have an acupuncturist that I go to for some concoction that she put together, but I don't know what's in it. But I tell people, make sure to do the things that we know work, like washing your hands and social distancing and spraying down surfaces before you go into any of the other things. Start with what we know for sure works.
And actually, my mom, not following directions, mom, has sent me a text message to my phone. And she asked, she has chronic asthma and is concerned about the fact that she needs to use the nebulizer for a more immediate effect when she's in the middle of an attack. What is the best advice for her?
Yeah, the best advice would be to actually go out onto a porch or a garage or outside.
Okay. And also we have another question. Revisiting the 17 to 27 feet that I heard about, is that more in the hospital or just speaking and breathing and out and about? Or,
yeah. Okay.
Or is that not determined yet and the 6 feet is okay?
Yeah, so really it's the 6 feet. So and you'll see, like at a lot of the stores, they put markers down so that you kind of get a sense of what 6 feet is. So really right now, the recommendation is 6 feet, not really anything more than that. But I do tell people 6 feet with a mask is almost like being 20 feet away from somebody.
Very good. And then we have another comment. No question. However, I've gotten on FaceTime with my friend and we exercise every day. It works and keeps us both uplifted.
Good.
So do we have any other questions? We had a lot of pre-questions today. That was good.
Yeah, that was great.
Okay. And I don't see any new ones coming in. So I think we'll give it just a second, but I think we,
okay.
Oh, wait. Oh, okay. So now my aunt is back on. My family is all in. My aunt is
Good.
back on, and she wants you to repeat what you were saying about the nebulizer. She wants to
Yes.
make sure that she understands.
That I think this is really important. So the nebulizer, what it does is it takes a droplet and changes it to an aerosolized. So you really don't want to use it at all in the home. You actually either want to use it not at all and use an inhaler with a spacer, or use it outdoors or in a garage, an area that you can kind of aerate. So just so that people understand this, and I want to make sure people understand it, the hospitals now that I work at, I cannot order a nebulizer in the emergency department. If you come in and you have an asthma attack, I'm going to treat you with like the old epi or terbutaline shots that you used to get. Even if you're in the ICU and you're on the ventilator, they are not going to do any nebulizer treatments in the hospital. Now, we have access to things other than that. When you're at home, you don't necessarily have access to things other than that. So I think it's important to use the aero chamber with a spacer, which delivers as much medication as a nebulizer. Or if you feel like you just must have a nebulizer, just make sure to actually go outside.
Absolutely. Okay. I'm getting the reminder that past segments are available on your YouTube channel. And I know you also post them on your website, which you shared earlier. And do you want to ask if people are interested in helping with the project? Are there volunteer opportunities?
Yeah, so we have a little group that's kind of formed. One person is helping like with communications. We're getting ready to do a segment on one of the Atlanta radio stations. And then one group is kind of working on funding, like how could we actually fund so that more presentations are done, we can bring in more topics. Ideally, I'd like to be able to, if we got a big funder, I'd like to actually go to one of the medical schools and actually really set up a community surveillance testing program done correctly in our community. Because the earlier you get tested, the better you do with this disease. So we have a little group, and if you're interested in doing anything like that, just, after this, you get a remark or a request or comment, and just let us know.
All right, and I have a hand raise. Oh, nope, the hand raise. Oh, yes, I do have a hand raise. One moment. And I hope I say your name correctly. Melissa? Oh, I'm sorry. One more time. Unmute yourself.
There you go.
There
Hi,
you go.
Dr. Val. I wanted to ask you whether or not you believe that everyone should get tested or just the people who may be exhibiting symptoms.
Yeah, so ideally, when you have an outbreak like this, you test the people initially who are symptomatic or in high-risk professions like essential health workers. Yes. Or the grocery store workers, transit guys. Those folks should get tested all the time, right? Which we're not, right? But you quickly want to go to what they call a community surveillance program. So a community surveillance program is, let's say I have a community and it's like 1,000 people in the community. I won't necessarily test 1,000 people, but I will randomly test maybe 100 to see how much has this disease penetrated this 1,000-person community, right? And if I see that this community is like, I tested 100 people and all 100 of them have this disease, then I may actually want to test everyone in that community. That drives my decision making. But if I test 100 and maybe there's one person that's positive, then you want to have that could be a community that could actually either go back to work or check to see if it has antibodies. So what is called in public health is a community surveillance program.
Okay.
So that is what we are not doing. We're not doing a community surveillance program. I think any talk about reopening the economy without a community surveillance program is irresponsible.
Do you think is it because there aren't enough tests, or
I've been emailing some of the people in the news, like, why aren't you asking why are there not enough tests? I mean, these are swabs. These are nasal swabs. What I don't understand what the issue is. I mean, we're supposedly you have the greatest healthcare system and such a big economy. I'm not clear what the issue is with ordering and getting these things processed. I know initially there was an issue where the CDC actually issued some tests and there was a problem with them. Then there was a problem where they tried to only do them through the public health departments, right. Which that's why I actually made the comment. The public health departments got immediately overwhelmed. So then they brought in, LabQuest and some of the other private companies. I don't see any reason right now why we're not doing more tests.
I don't either.
I don't either. And I don't, I'm like, that is like the biggest question. People say, well, when we begin to do more testing, well, why aren't we doing it now?
I'm a former medical secretary who spent 15 years of my life working in the ER. So I understand a lot of the issues and things, but I really don't understand it, especially for people that are baby boomers like I am.
Right.
I'm wondering if all of them should be tested, because to me, just watching the news and trying to pay attention and learn as much as I can, it seems that a lot of people who are older, especially those who have passed, it's not just that they died from the coronavirus, it's that they have other issues. They're
right.
overweight, or they have diabetes and they're overweight, or they've got COPD, whatever it is. And I've been wondering whether the older population should be tested anyway, whether they have the virus or not. But
right. So let me tell you that the inmates at Cook County Correctional Facility filed a temporary restraining order demanding that they be tested and be given PPE and all of that sort of stuff, right? So they actually went before a judge in chambers and won. The judge required that all correctional inmates, and some of these people are people that just can't make bail. They haven't even been found guilty, right? This is the jail, right? So he required that all correctional inmates be tested within 48 hours. This was like Friday or so. By Sunday, they had tested about 400. They hadn't tested all of them. 85% of the inmates were positive.
Wow.
I
Right?
can't believe it.
85. Then what happened was the union woke up and was like, oh, wait a second. Because now the inmates are being tested. The inmates are getting PPE. And the correctional officers are not.
Right. Makes no sense. It makes absolutely.
Tell me your name again, Melissa. Am I saying it
Melissa?
Melissa.
It's just spelled different. That's all.
Oh, okay. Thank you for sharing that, Melissa. We have other questions. Did you have another question?
No. Thank you very much.
All right.
You're welcome.
Joining.
Yeah.
All right, and I'm going to go to Sharon, and then we have another question in the Q&A. Sharon, you can unmute yourself and ask your question.
Hi, Val. This is Sharon. How you doing?
I'm doing good.
Good. I just wanted to know, what was your thoughts on the 5G speculation? Do you think this virus have to do with that, or is it really a virus? Because I'm hearing a lot that it have to do with this new 5G. And
yeah, so I don't think it has anything to do with 5G, but it did come from bats. That we know for sure. Now, one of the things that we don't know for sure is, did it come from a lab versus did it come from the live markets? So there is some reporting from the Washington Post that the State Department sent someone out to a Wuhan lab that was testing bat coronaviruses. And they were very disturbed about the sanitary conditions there. And they sent wires back to Washington, D.C. Now, the Wuhan live markets are like 1,000 miles away. And so that is yet to be seen. So I don't think it's 5G. I mean, this is my opinion. It's going to take some time to figure this out. But it could be, though, the conversation about did it come from a lab is actually on the table as a possibility.
Okay. All right. Thank you.
Sharon. All right, and a question in the chat. I think you've answered this in other webinars, and I have some friends working in nursing homes where they've
Yeah.
not yet, where they have not yet been outbreaks. What can they start and continue to do to protect themselves if they work in housekeeping or the kitchen or those working on the front lines?
Yeah, so it's very important for them to have PPE, the mask, the N95 mask, and the gloves and all the protective equipment. The other thing that's important is that when you actually, for cleaning staff, what we do is if a room empties, then they don't go in and clean it for 2 or 3 hours, which allows all the platelets of particles or droplets to drop, right? The other thing that I tell people to do that is very important is to actually, when you go home, take your shoes and take your scrubs off, preferably like in a basement or a garage. I have somebody who lives with me who works at a hospital. We've set up the downstairs bathroom. She takes her clothes and her shoes off and takes a shower and comes upstairs.
All righty. And let me just check literally all the devices now that everyone is sending questions in every form. I think we are good. I don't have any.
All righty. Well, thank you for coming. And then we do this every Tuesday and Thursday. And so if you have other family members that you actually, want them, this is all set up so that people can actually really create something to protect their families and their communities. So if you have other people that you actually want to hear the information, you can forward the invite to them when you get it.
All right.
All right. Thank you guys for coming.